Joining us now is Leah Carpenter, nurse and CEO of Memorial Hospital West in Pembroke Pines, Florida, part of the Memorial Healthcare System. Leah, thank you for being with us. I mean, it's a remarkable story that you've actually had to pitch in. You're obviously not doing it for the photo op, so you actually have staffing problems. We've heard about personal protective equipment shortages. We've heard of convalescent plasma possible shortages. We still don't have adequate testing equipment around this country. But you also, on top of that, have a staffing problem.
That is correct. I can tell you we started really initially having space concerns, but with a little creativity and ingenuity of my construction teams, we've been able to expand and create additional spaces elsewhere in the hospital. We're staffing adequately at this time, but I can tell you that it's more related to nurses taking additional shifts and really just their commitment to making sure that our patients have everything that they need. So many of my nurses are taking 1 to 2 additional 12-hour shifts a week. And they do it with a smile on their face, but we're concerned. We're concerned about their well-being.
Yeah, I'm always fascinated when I'm in a hospital to see nurses and doctors with a smile on their face, understanding that the turmoil and the trauma that goes along with that job. How is everybody holding out? Because we are now into our 5th month of medical professionals being on the front line of this devastating illness.
So I think a lot of it has to do with leadership. It starts at the top with our board and our senior execs. We make every effort to make sure that our employees are well taken care of, not just from a financial standpoint, but making sure that their mental, emotional, spiritual well-being is taken care of as well. And we give a great deal of focus on that, even while they're on their shifts, making sure they have the support that they need. You know, it's not just about the ventilators and all of the equipment that they need, but we need to make sure that their physical and emotional well-being is healthy too.
Tell me what you're seeing in the hospital with respect to patients for those in the country who still think this is a civil rights issue and they should be free to hang out with anyone they want, not wear masks and not social distance. What's the message that what you're seeing makes you want to deliver?
So my message would be that this is as real as it gets. And if we don't all come together in terms of masking, social distancing, and frankly, keeping away from each other just for a little while, this is going to get worse. It's not a joke. The masks are absolutely needed. And I just can't stress enough that if we don't all do our part, you will absolutely overwhelm the hospitals, and we won't be able to do what it is that we're destined to do.
I want you to talk to me a little bit about what overwhelming the hospitals means. In Broward and Palm Beach County, hospitals are at 83% and 73% of capacity, and all but a handful say that their intensive care units are at or near capacity. The reason I ask you to tell me what this means is because for people who think they're not going to get COVID, emergency rooms and ICU beds exist for everybody who gets sick in any way, in an accident, in your appendix, something goes wrong with your appendix, you need emergency care. When these ICUs are full, they're full for everybody.
That's absolutely right. It's so dire at this point where we've had to actually separate parts of our hospital. So we have 2 emergency rooms now. We have one for, as you said, appendicitis and all of those other very, very critical issues that people come to an emergency room for. And then we have a separate emergency room strictly for COVID so that we can isolate those patients and prevent the spread. Right now, my ICU is at 187% capacity. And I'm able to do that by creating additional spaces. But it is what it is. Sooner or later, we will run out of space. So we've got to get control over this disease, and we have got to stop the spread. The good news is that about 98% of the people who come to the hospital are discharged. But if you go into an ICU, you have a 30 to 35% chance of never leaving. And so wow. It's very serious, and we have to make sure that we're not just thinking about ourselves. Many of the young people have heard, young people are not impacted by it. But first of all, they are. We're starting to see younger people impacted and sick and in our ICUs. But more importantly, they're the ones who are spreading it to those who are most vulnerable. So there is no one who is immune from COVID. It does not discriminate against anyone.
Let me ask you about the euphemisms that different medical systems use for describing triage. You, as a nurse, know that word well, right? You are endlessly evaluating what level of care a person needs. When emergency rooms and ICU beds become full, there are all sorts of things. In Arizona, they're using diversion. Emergency rooms are saying we're not accepting hospital rooms, or people are getting checked out. But it's all some version of triage. It's all some version of someone making a decision about your health care that's not you, because the capacity, there's no more capacity.
So the fact is people can use the word diversion as often as they'd like to, but in Florida, there really is no diversion. There is an expectation that patients are going to be taken to the closest facility for their well-being. So you're not exempt from that just because you're full. The triage happens at that point. It also happens when they actually arrive to the hospital, at which point we determine where they are best fit. Are they going to go into a COVID tent? Are they going to go into a COVID ICU or to a COVID ER? Or are they going to go into a general emergency room? So there's varying phases of where that triage can happen.
Leah Carpenter, we are grateful to you for the work you're doing, and for the work you're doing not just as the CEO of Memorial Hospital West in Pembroke Pines, but for the work that you're doing as a nurse when you are shorthanded. Thank you for your time this evening, and we wish you the best of luck.
Thank you so much.